Hi everyone, it's Friday again. Well, I hope everyone had a great new year. So today we're going to talk about some smart consumer choices. Now, some expenses we have are fixed and others we have that we can kind of compare and shop around. But today let's talk about your health care. How can we save money on our health care? Now, our bi-weekly deductions that come out of our payroll for health insurance, that's a fixed expense. So one way to manage your costs within your healthcare plan is to familiarize yourself with your health plan. Know what your deductibles are. Know what type of services your plan provides. You know, about 43% of all consumers are unengaged with their health plan, meaning they don't really know what their deductibles are or what services are covered. Okay, regardless of who your health plan is with, they're more than likely will have a website or an app to help their members to understand their health plan. Now, the city's health plan is with UnitedHealthcare, and UnitedHealthcare has a one-stop self-service resource with personalized health information on it. It's called myuhc.com, and it provides members with information on medical and pharmacy. It provides information on claims data, and there's also tools to help you manage your health plan and your health care more effectively. Now, myuhc also has a mobile app that you can download to your iPhone or your Droid. Now, it puts everything at your fingertips. It's with you wherever you go, has all the same information that the website has. Now, regardless of who your health plan provider is, here's a few tips to help save you just a few dollars. Number one, always use an in-network provider. Now, if you use an out-of-network provider, the result's probably going to be you incurring a higher percentage of the cost. Now, it may also, by using an out-of-network provider, may affect your deductible. You want to search for in-network providers within your own health plan. Now, for UHC members, you can locate an in-network provider on your myuhc.com app or website. Now, you want to look for preferably a premium designated provider with UnitedHealthcare, because these are physicians or healthcare providers who have a premium designation, meaning that they not only practice quality care, but they are the most cost-effective provider. Now, I just want to add a little side note on that. Now, once you've made that decision of who you want to see, who that provider choice is, be sure to give them a call just to make sure that they do accept your insurance, because sometimes, providers can be on and off plans at different points of time, and sometimes there's a little lag time between when that occurs and when it goes onto the website. Okay, my second tip is to shop for the cost of a service. Say, for example, you would need an X-ray or a CT scan or an MRI. Now, this is especially important if you have a high deductible plan. Now, there may be several independent facilities that offer the same services that your major health plan networks offer. So you need to really investigate that, because you could have a huge savings there. For example, let's say you need a CAT scan. You might have an independent radiology facility that can perform the same service as your major health network, and oftentimes they're staffed by the same radiologists who are reading reports, whether it be in the hospital system or be at the independent facility. But it could be a huge savings to you. Same is true also with physical therapy services. There's many independent physical therapy services that offer the same services you receive in a huge health system, and you'll get the exact same care but at a lower cost. And the one way that you can, with your health insurance with the city, that you can cost compare and shop is go to myuhc.com, and they have a cost calculator which will help you make that decision. There is one disclaimer I want to add to this, though. Before making a final decision on where you're going to choose to have a service for, say, an X-ray or a CT scan or MRI, you might want to check with your ordering physician, because if this would be something that's being ordered, such as a blueprint, that's what the doctors refer to it as, a blueprint for, say, an orthopedic surgery, your doctor's going to want to make sure that the software that they use, the CD disc that they use at the independent facility, will be compatible with the software that they use in the surgery center. Because I know with joint replacements, a lot of times you get a CAT scan done and it's used as the blueprint, and so it's needed the day of surgery. So you want to make sure that that's compatible, and your doctor should be able to tell you before you schedule that appointment to have the test done, because they're familiar with all the different facilities around. So they should be able to tell you if their equipment will be compatible with what they'll need for your surgery. Now let's talk about ER versus the urgent care. Now most urgent cares are used for the minor type stuff, minor cuts, scrapes, bruises, sprains, things like that, and they are very cost effective. Now your ERs, they should be utilized for your chest pains, your shortness of breath, your traumas, your motor vehicle accidents. Misuse of ER services is a real cost driver in our health plans, so we need to evaluate and decide, if we have a situation, is it something that's could be more effectively treated at urgent care versus an emergency room. So you got to kind of plan ahead. Know the immediate area where you live, know where your urgent care locations are, know what services they're capable of performing. Some urgent cares can do x-rays, some can't. So know what kind of services they can provide and also their hours of operation. Now, if something occurs, you need to consider what your chief complaint is. Your chief complaint is, if it's something that can be managed, say, with some over-the-counter type medications until you can see a doctor the next day, or it's something that doesn't need really the hands-on touch, or it's something that you really just are looking for a script for, then it's probably not an ER type visit. So it's really something you should lean more towards, either waiting until you see your doctor in the morning or go to see an urgent care. Now, with the pandemic and the coronavirus and what's going on, really consider whether or not what's occurring is an appropriate ER visit or it's something that could be treated at an urgent care. Now, I want to add a side note here, and this is coming from Cathy, the consumer. Okay, I want to let you know that many of our ER providers, they can be ER docs, they could be physician assistants, they could be nurse practitioners. Many of them are not employed by the healthcare system or the facility that you go to. So they're independent contractors, and so they may not be considered in-network providers. So you'll often receive a bill separate from the facility charge, and it can sometimes be a little bit steep. So just kind of forewarn you on that. And also to remind you that now these freestanding ERs are real popular in many cities. So just remember, they are an ER, they are not an urgent care. Another great tip is take advantage of your virtual visits or your telehealth visits or your doctor on demand visits. Take advantage of them. It's real time with a doctor. It's a time saver for you. You don't have to even leave your home. You don't have to worry about gas, parking, anything like that. They're perfectly able to handle any kind of minor illnesses such as urinary tract infections, sinus, cold type symptoms, and they're even able to send an order for a prescription to your local pharmacy. So take advantage of those whenever possible. My next tip is, of course, to always use generic versus the brand. Now, generic typically is less expensive, significant savings in fact, versus the brand. Now, there are a few situations out there where the brand is cheaper than the generic, and if that's the case, then your pharmacist will make that substitution for you. Another thing you might want to consider is 90-day supplies of your prescriptions if it could offer a cost savings, and also consider mail order if that's an option for you in your healthcare plan, because with mail orders you not only save time, save gas because you're not running back and forth to the pharmacies and waiting in line to have your prescriptions filled, and you always have your meds and you're never missing a dose. My next suggestion is to take advantage of any kind of programs that are available through your health plan and or your employer. Your health plan and your employer partner together. They offer programs such as Real Appeal, Quit for Life. With United, have case management programs, diabetes programs, cancer programs, and things like that. So take advantage of those programs. Also available to you through your employer is EAP and also their new financial wellness program. Now, these are all programs that are not offered to help you save money, but also to help improve your overall health and well-being. And lastly, don't forget your preventative care. Now, 86% of healthcare costs are driven by chronic conditions. So follow through with those preventative care visits. Make sure you see your doctor at least annually, and make sure that you follow through with all the preventative care testing procedures that are recommended for you. Now remember, early detection means better outcomes. Well, these are just a few ways that we can all be smarter consumers and maybe put a few bucks back in our pocket. So now if you have the city's health plan, you need help navigating myuhc.com, you need a provider, or need help with, say, the cost calculator, contact me. I'll be glad to help you. I'm available either by email or by phone, so just give me a call and I'll be glad to to help navigate you through the myuhc.com app. So just want to remind you that on Monday, Ashley will be talking about organics and GMOs. And I've got to tell everyone, don't forget to wear your scarlet and gray on Monday because it's the national champion game. So we want to say go Bucks!